Hello, dear friends. Welcome. Today, we're going to talk about a very personal and important topic for us gentlemen, especially as we reach our golden years. It's about looking after our testicular health, a subject that sometimes gets overlooked. Have you ever felt a bit uncertain about what to look out for? Or perhaps you, or someone close to you, lives with a single testicle and wonders if there are any special health considerations? Well, you're in the right place because we're going to explore this together, gently and clearly. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 10. If you don't like it, comment number 0 to let me know so I can make a better video for you. Now let's get started. Normally, men have 2 testicles housed in the scrotum. They're vital for producing sperm and hormones. However, some men may have only 1 testicle, perhaps from birth, or due to surgery, for various reasons. If this is your situation, or that of someone you care about, it's particularly important to be aware and proactive about your health, especially concerning the risk of testicular cancer. While having 1 testicle doesn't automatically mean you'll get cancer, vigilance is key. This condition, though, does mean that your 1 testicle is doubly precious, doesn't it? So, let's learn how to protect it. Now, how does your body let you know if something might be wrong? Testicular cancer can send out what I like to call signal flares. Let's talk about these signs, these abnormalities you should be alert to. First, let's discuss pain and discomfort. Sometimes the very first sign that something isn't right is a persistent ache or a feeling of heaviness in your testicle or scrotum. It might be a dull ache or perhaps a sharper pain. You might also feel discomfort in the area that just doesn't seem to go away. This pain can occur because a tumor is growing and pressing on sensitive tissues or nerves. It's your body's way of saying, hey, pay attention here, please don't. Dismiss these feelings as just part of getting older. Next, we need to talk about lumps and swelling. This is perhaps the most well-known sign. You might discover a small, hard lump, maybe the size of a pea or a marble, on the front or side of a testicle. Or you might notice a general swelling of the testicle or scrotum. Often, these lumps are painless, which can sometimes lead men to delay seeking help. But any new lump or swelling is a crucial sign. If you find one, it's so important to have it checked by a doctor without delay. We'll talk more about how to check for these soon. Another subtle change can be testicular enlargement. 1 testicle might start to feel firmer or grow larger than usual, or it might feel different from how it has always felt. Sometimes this change can be gradual, making it harder to notice day by day. That's why regular awareness is so important. It's not about looking for trouble, but about knowing your own body well enough to spot when something has changed. And here's one that might surprise you. Lower abdominal or back pain. You might wonder, what does my lower belly or back have to do with my testicles? Well, in some cases, testicular cancer can spread to lymph nodes in the abdomen. When this happens, it can cause a dull ache or pain in the lower abdomen, groin, or lower back. So, persistent pain in these areas, especially if you can't pinpoint another cause, could be linked and warrants a discussion with your doctor. So, with these signals in mind, what's the most powerful tool you have? It's regular self-examination. Doing a monthly checkup is truly key to building a strong line of defense for your health. How do you do a self-exam correctly? It's quite simple, and you can easily make it part of your routine. The best time is during or after a warm bath or shower, when the scrotal skin is relaxed. Gently take 1 testicle at a time between your thumbs and fingers of both hands and roll it gently. You're feeling for any hard lumps, smooth, rounded bumps, or any change in the size, shape, or consistency of the testicle. It should feel smooth, without lumps or bumps. Get to know what feels normal for you. It only takes a minute or 2, and why is the frequency so important? Checking yourself once a month, around the same time each month, helps you become familiar with the normal feel of your testicles. This way, you're much more likely to notice any small changes early on. Think of it like checking the air in your car's tires. Regular checks can prevent bigger problems down the road. It's about regular, gentle guarding of your health, not about living in fear. Now, what if you do find something concerning during your self-exam? This brings us to a crucial point: early. Detection and early treatment are like being in a race against cancer, and you want the best possible head start. Seeking timely medical attention is absolutely vital. If you notice any of the signs we've discussed, a lump, swelling, pain, or any other change, please make an appointment to see your doctor as soon as possible. I know it can be worrying, and sometimes men feel embarrassed or try to wish it away, but time is precious. Catching testicular cancer early significantly increases the chances of successful treatment and a full recovery. This is your golden window of opportunity. When you see your doctor, they have several ways to find out what's going on. They'll likely start with a physical examination. They may also recommend an ultrasound scan. This is a painless test that uses sound waves to create a picture of your testicles and can help show if a lump is solid, which might suggest cancer, or fluid-filled, which is usually not cancerous. Blood tests can also be helpful, as some cancers produce certain markers that can be detected in the blood. These tests help your doctor get a clear picture and make an accurate diagnosis. And if it does turn out to be testicular cancer, please know that there are diverse and effective treatment options available. The main treatment is often surgery to remove the affected testicle, an operation called an orchidectomy. For many men, especially if the cancer is caught early, this might be the only treatment needed. In other cases, depending on the type and stage of the cancer, radiotherapy, which uses high-energy rays to destroy cancer cells, or chemotherapy, which uses anti-cancer drugs, may also be recommended. Your medical team will discuss the best plan for you. There is a lot of hope, and treatments have advanced wonderfully. So, my dear friends, as we wrap up, I want to leave you with a message of empowerment. Living a healthy life is fundamental, and this includes looking after your testicular health, especially for those of us with a single testicle. This means being aware of your body, adopting good health habits like a balanced diet and regular exercise, and, crucially, performing those monthly self-exams. Don't let fear hold you back. Instead, let knowledge and proactivity guide you. You are the guardian of your own health. By staying informed, checking regularly, and seeking help early if needed, you are taking powerful steps to protect yourself. Remember, you're not alone in this. Talk to your doctor, share with loved ones. If you feel comfortable, let's support each other in living long, healthy, and joyful lives. Thank you for listening. Take good care.